Welcome back. Family-focused home health care is a local business, and we're taking a close look at them today. Jim Borngesser is the CEO of the company. Welcome, Jim. We're glad to have you.
Thanks for having me.
You know, a lot of people, when their parents need care, long-term care, oftentimes they don't want to put them in a nursing home or in some sort of institution, and oftentimes it's the parents' wish to not do something like that as well. So you're a great alternative.
We are. The vast majority of people want to stay home. It's where they're comfortable. It's where their friends, their family are, their community is. So they really want to be able to stay home for as long as possible. And that's where we come in. We can make sure that that happens. Okay,
tell us what types of care you're able to provide for the families.
Sure. We're a home health agency. We are registered by the state of Florida, which is ACA, and we do personal care and companion care. So that means we can do things as far as showering, personal care, showering, bathing, toileting, and things like that. Companion care is where we would do things with the patient. So that's taking them to appointments or cooking meals for them or do some light cleaning. So that way, in companionship, you know, we can hang out and they've got somebody to talk to during the day or the night, but they've got somebody there with them, so they're not alone.
And that's really important, especially there seems to be such a trend of working people and their parents are aging, and so they want to bring them into the house.
Absolutely. Well, and you have the baby boom generation as they're getting older. It's such a large group of people that do need help, and you're right, their kids are working, and all their kids are working, you know, so they can't take care of mom and dad as well, or grandma and grandpa as well as they'd like to, and that's the gap that we can fill.
Okay, I think that's wonderful. So I guess you guys can come in as much as someone wants you to, or and provide a respite care as well as maybe...
We absolutely do. We'll come in, we do an assessment, and we determine a plan of care, and we work that with the patient and with the family so we can make sure that they're getting everything they need. Our focus is a little bit different than other agencies. We really focus on the patient, the caregiver, and the family. We actually really focus hard on that triad. And what can we do to help the family? Because a lot of times they need some care management, or sometimes they need help. Oh my gosh, I didn't realize mom and dad's house was so dirty. You know, do you know somebody who can come and clean? Because, like as you were saying, they're busy, they work, they might live in Washington State or California. You know, they're not necessarily here. So we can try to fill that gap.
Well, and it's very, I mean, I'm sure it can be quite challenging for families because they're trying to, like you say, work, and then if they have their own children at home, and then being able to give their parents 100%.
This is the sandwich generation.
Yes, it really is.
Absolutely.
Which I think is fantastic. Tell us, you know, where you guys, what area that you serve.
We actually cover the whole Northeast Florida. We're not a franchise, we're locally owned, we're independent, so we cover really these 7 counties that are here, from Baker to Nassau, Duval, Clay, St. John's. We go down to Flagler and actually Volusia, so we can cover that whole section. And you know, we bring our expertise as far as what we can do to help care, and we do things a little differently.
Okay, so tell us how, I want to hear how your guys are a little different, because I think that's one of the intriguing things about you.
It's pretty cool what we do. We have to do the care that's in that plan of care as far as those personal care, companion care, but there's a lot of time usually left over. And nobody really does anything with that time. And we developed our program called Synergy Care, which is where we're centered around, again, the patient, the caregiver, and the family, and what can we do for them. And we have 2 key programs that are in there. One's called our COGS kit. And here's a kit.
Yeah, let me see that. So this is a COGS kit. Now, in other words, it's help for people cognitively to keep their memories sharp and so forth. And so you guys actually sit down, or your workers sit down with them, and I guess, is this something that someone made, this little birdhouse?
This is an actual COGS kit from an active patient. And you're right, COGS is short for cognitive stimulation. And cognitive stimulation is around their senses. So we can do crafts, and we'll do different crafts, birdhouses or little medallions, jewelry boxes.
Nice.
We'll do games, because you've got to stimulate the mind. So we've got games, we've got bingo, we've got...
What kind of games? Because a lot of times, you know, and I've heard this from doctors before, where they tell families, if you're going to have your mom or your dad around, and, you know, keep them stimulated, keep their minds busy. What are we supposed to do to help?
It's this, with this open time, it's how do you keep that mind going? And don't forget, it's the mind and the body. So we'll do chair exercises. We've got a set plan of those that we do with our caregivers. And we'll come in and we'll talk about memories. Because if you stimulate that mind, especially through the day, it helps the family later at night as they're trying to get, you know, their mother or their father ready for bed.
You're talking about memories in terms of asking them to talk about something of their childhood or
They've got so much richness in their past. So how do we pull that out? And we do that. Our caregivers, they'll pull out their cell phones. And they'll start recording a memory. And what we'll do is we'll put that on a server for the family, but they'll take this and they'll record it. It's just, we're already having these conversations, so we want to document it, and this is where the family part comes in.
I think that's great.
For that family member that's in Washington or California, they can still participate, because we'll put it on the cloud in a safe, secure server, and they can pull it down anytime they need.
And God forbid they say something they shouldn't.
Well, they're family is family.
I can see that right now. That's hilarious. Okay, we also have puzzles and so forth, because this is those things that you can do with them. So they're not just doing it by themselves, you're doing it with them. And I guess everybody has different interests. So you would just find out what they might like.
Through that assessment, we try to find out what their likes are, what their likes aren't. If they don't like jigsaw puzzles, then we won't have jigsaw puzzles there.
Right.
There's a lot of people that actually, we do card games and things, but they might not know how to play bridge and things like that. So you scale it to the needs of the patient. Some patients can do more and some are less.
Right.
So we scale it that way. And then that's where we talk about, the other side of it is not only our COGS kit, but this Project Pensive, as we call it, for the memory piece.
I love that.
It's great stimulation for the brain, but it's great for the family to capture those memories.
Oh yeah, because then they always have them.
They
and
do.
Sometimes I would think family members are more likely to open up to someone like you guys than maybe their own family on certain subjects.
They really are, because they're already there and we're having the conversations with our caregivers. And all we're just trying to do is just put this here, and it's not as intimidating as have a big camera and lighting set up in place.
Right.
And so they can have just this casual conversation, and things do come out. And there's, right now we haven't had an instance where we had to edit a lot, but you have conversations that come out, and it's very interesting for the family as far as great insight. Insight is that I didn't know Dad was thinking about that,
Gotcha.
or Mom was thinking about this, and
It sounds wonderful.
it's really neat.
What I like about it seems like you take a real personal and humane approach, especially this is the time where people can be, very specific about what they might need. We only have about 30 seconds left, and I want you to make sure you get your point out in terms of where we can call you and where we can find you, because it sounds like a great service.
You can always find us on the web. We're at familyfocusedhhc.com. So you can always go there, and our full story is there. You can learn more about us and what we do. Give us a call. 904-999-4464. We're there. We can answer the call. And love to answer people's questions, because not a lot of people know about home health care, let alone something like a COGS kit or Project Pensive, where we can capture memories and create a memory bank for people over time. So we've got a lot we can talk about.
I love it. All right, Jim, thank you so much.
Thank you so much.
Jim Borngesser.
Appreciate it.
it.